Namaste. This 7 years girl has measles and pneumonia, and she also has asthma. We learned this time. She was coughing a lot. After giving all medicines, her cough would not reduce, and we gave her oxygen. As we gave her oxygen, her cough reduced. She felt better. How oxygen helped? See, we breathe to take oxygen. With pneumonia, part of the lung was not working. So to take air, she had to breathe more. With every breath, the air hurt the air pipe, the throat, and she coughed. As we gave her oxygen from this cylinder by this tube, the oxygen percentage increased from 21% oxygen which is in room air to more. We were giving her 2 to 4 liters per minute, 2 liters per minute. So she had to breathe less, and that relieved her cough. Lesson: if cough is not going, try oxygen. This is number 2. Number 3, a 7 years girl should not get measles. Government gives measles vaccine free because measles is a major killer of children, and if elders get it, it is more serious. We pray to government that they should give MMR vaccine in place of measles. And we should give measles vaccine twice, once at 9 months and once again at 15 months or more. We pray to government that they should give MMR, which is a vaccine for measles, mumps and rubella. Government is planning MR, measles and rubella. But at a small, very small 1% more cost, we can add mumps vaccine and give MMR vaccine. Kerala, Sikkim, Goa, Pondicherry and Delhi state governments give MMR vaccine free to all people. Many governments on the earth give MMR vaccine free to all the kids. We too should, because mumps is the commonest virus causing brain damage, brain illness called as encephalitis. And we must give MMR vaccine. Indian Academy of Pediatrics is association of all India's 23,000 pediatricians. It tells government to give MMR vaccine, and so we also should tell. So go to mygov.in and request Prime Minister to give MMR vaccine in place of measles vaccine, and write a letter to Prime Minister. Tell all. Thank you very much. Dr. Hemant Joshi, Virar.